Ophthalmic lasers. Laser is a form of optical radiation affecting biological tissues by the following mechanisms: photochemical reaction, photodynamic therapy, photothermal reaction, argon laser photocoagulation, photomechanical reaction, and the YAG laser, photoablative reaction, erbium laser. All biological effects of laser induce tissue damage followed by repair process. Laser effects. Photothermal reaction. Optical radiation is transformed into heat energy. In photothermal interaction, heat dissipation outside the target tissue may occur, inducing thermal damage. Forms. Hyperthermia. Elevation of temperature to 45 degrees centigrade, avoiding coagulation or vaporization. Tissues undergo conformational changes, resulting in bond destruction and membrane alteration. Used in ophthalmology. Hyperthermia for choroidal neovascular membrane. Thermotherapy. Temperature elevation above 45 degrees up to 60 degrees centigrade, inducing in-depth tissue coagulation and necrosis. Uses in ophthalmology. Transpupillary diode laser thermotherapy for choroidal melanoma and retinoblastoma. Photocoagulation. Temperature elevation above 60 to 80 degrees centigrade, inducing superficial tissue coagulation and necrosis with shrinkage. Uses in ophthalmology. Argon laser photocoagulation for clinically significant proliferative diabetic retinopathy. Photovaporization. Temperature elevation above 100 degrees centigrade. Water molecules vaporize, resulting in mechanical rupture of tissues and thermal decomposition of fragments. Laser interaction with tissues. Reflection. Incident light energy is backwards directed to the half space of origin. Reflection depends on changes in refractive indices in ocular media, angle of incidence. Reflection decreases the effective power of the laser energy and may harm the operator. Scattering. Deflection of optical radiation from target in an optically non-homogeneous medium. Optical radiation is absorbed by particles in the medium and re-emitted at same wavelength but at different angle. Scattering is minimal when ocular media are clear. Absorption. Incident optical energy is partially lost in the form of thermal or chemical energy into tissues. Melanin strongly absorbs or ultraviolet and visible wavelength. Hemoglobin strongly absorbs violet 420 nanometers, yellow and green 540 and 580 nanometers. Argon green and yellow lasers are absorbed by intraretinal blood, inducing damage. Argon green and yellow lasers are also absorbed by hemoglobin in choroidal neovascular membranes. Argon green and yellow lasers are also absorbed by hemoglobin in choroidal neovascular membranes. Yellow discoloration of the lens absorbs blue-green lasers. Xanthophyll strongly absorbs blue 460 nanometers light. Avoid blue-green lasers in foveal area. Transmission. The part of incident optical radiation penetrates in target tissue following reflection, scattering, and absorption. Different ophthalmic lasers. Argon laser. Nature, ion, gas laser using argon ions as a gain medium pumped by electric discharge. Wavelengths 488 nanometers, argon blue, absorbed by xanthophyll pigment inducing foveal burn. 514 nanometers, argon green. Transmission through refractive media is 80%. Effect, photothermal coagulation. Light is absorbed by the retinal pigment epithelium and converted to heat. Diode lasers. Nature, solid state laser. Wavelengths. Infrared laser of long wavelength 700 to 820 nanometers. Effect, photothermal effect. Advantages of diode lasers. Well transmitted by ocular media, less than 5% absorption rate. Minimum absorption by melanin and oxyhemoglobin. Lack of xanthophyll absorption, safe for delivery to the macula. Lack of hemoglobin absorption allows penetration through thin layers of pre-retinal or subretinal hemorrhage without excessive laser energy uptake. Disadvantages: vascular abnormalities as retinal angiomas or retinal telangiectasia cannot be directly treated with the 800 nanometer wavelength because it is not absorbed by hemoglobin. Photodynamic therapy. Principle: activation of a dye by low-power laser light to induce coagulation of the neovascular complex. Dye used is verteporfin dye. Laser used is a modified diode laser. Wavelength is 689 nanometers. Power is 600 microwatt per centimeter. Duration is 83 seconds. Neodymium doped yttrium aluminium garnet and Diag laser. Nature: short pulse mode solid state laser. Wavelength 1064 nanometers. Effect: photodisruption, optical breakdown, explosion, physically disrupting tissues. Creation of high temperature plasma inducing cavitation, shock and acoustic waves producing mechanical tissue disruption. Used in Nd:YAG laser, iridotomy and capsulotomy. Excimer laser. Nature: gas halide or gas metal vapor lasers emitting in the ultraviolet that operate via the electronic transitions of molecules. Wavelength 193 nanometers. Effect: molecular tissue disruption. Erbium YAG laser. Nature: solid state laser. Wavelength 2940 nanometers. Mid-infrared spectrum. Pulse wave. Effects: photoresection and photoablation, used as surgical knife and to induce hemostasis.